The views, opinions, and statements expressed in this program are those of the individuals involved and do not necessarily reflect the views or positions of Anything Entertainment Network.
You know already what the hottest podcast is in the world, the Brik Talks podcast. And so we're on Anything Entertainment Network. Make sure you download that and share it with all your friends and come out and check out some of the conversations that we're having. We got some really riveting conversations. We're talking about community. We're talking about culture. We're talking about loving and helping one another to just build a great community and to build great surroundings in our community. Make sure you look for us on YouTube. We're on social media. Keep building, y'all. Keep it Brik. Hello, welcome to Brik Talks, and I'm your host, the Brik Chick. And today I have Dori. Can you please tell me your last name?
Yes, Latek.
Latek.
Yes.
Because I was going to say latex. We have Dori Latek here with us today. She's a LMSW, a licensed master social worker.
Perfect.
And she is great in the community. She's helping us a lot with mental health and underserved communities and marginalized people. And I had the chance to meet her and I brought her on and she has a lot of great information. So welcome, Dori.
Thank you. Thank you so much.
Thank you. So your journey began at Nazareth University.
Yes.
Okay. And led you into community outreach.
Yes. With
Charlie Help. Okay. All right. What originally inspired you to pursue social work and how has that purpose evolved since earning your LMSW?
Yes. So, I kind of think back to middle school, high school, even when that was really when I first started to have my own mental health struggles where I'm like, why am I, growing up and you're 13, you're like, why am I so moody? Everything's blamed on being a teenager. It's just how you are. But there's a lot more to that story. And not to age myself, but then it's also mental health was really just not as talked about. Thinking back 10, 15 years ago.
Taboo.
It was very taboo, swept under the rug. Not a lot of parents wanted to talk about it. Not a lot of students wanted to talk about it. And then, really unfortunate, but my community dealt with a lot of losses due to suicide. So we continuously had, whether it was, peers that were our age or parents dying by suicide. And it still continues to happen to this day in my community, which is originally from Chicago area. But that doesn't mean that other communities feel that impact too. So that really drove me into the social work profession, knowing how can I give back in that sense? One, bringing more awareness and education to mental health. It is so important. And it's just not always talked about enough. So that really led me into getting my master's in social work at Nazareth University here in the Rochester area. And really kind of kickstarting my journey off that way.
That's great. And do you think that some of the resistance to talking about mental health and families was that parents maybe felt like they were a failure or that the children felt like they were throwing their parents under the bus if they weren't these perfect images of, because I'm assuming upper middle class.
Yeah. And I think a lot of it too was, people just not being understand that mental health can impact anyone, anyone and everyone too at the end of the day. And I think we also tend to live in a society where it's really quick to kind of point fingers and blame. And I think that, parents felt that, other students felt that, where it's really quick to point the fingers on who is in the wrong, who's in the right. But it's not always about who's wrong, who's right. Someone might just need some extra support, some extra help, and just breaking down that barrier there where we can't talk about it.
I know. A lot of it is chemical imbalances too. So
yeah, absolutely.
So you built strong clinical skills, at Gavia. Am I saying that right?
Yes.
Okay, Life Care Center and Wayne Behavioral Health.
Yes, perfect.
Okay. And how did those experiences prepare you for the outreach and system level work you're doing today?
Yeah, and I love that question. So, starting off with Gavia, Wayne Behavioral Health Network, working as a mental health therapist, I was working with individuals in both roles directly providing therapy services to them. So my experience there was using different modalities when it comes to therapy, CBT, DBT, motivational interviewing, and really treating the patient first care. I'm sure you know that too. It's so important, meeting them where they are at. And really from there is just noticing that there were more systemic barriers to the patients I was working with. In behavioral health, as we know, they are a little bit more further away from the city of Rochester. So transportation was a huge barrier for many of the students I was working with there when they were needing different services that were offered more specifically in Rochester region. Right. They weren't able to get there. So it kind of was reminding me that there is such a bigger picture of what's going on, and there is a lack of transportation. And that was a huge one too. So I kind of shifted into this role doing outreach for Charlie Health, where, now instead of working in a clinical setting where, I'm not providing therapy services at this time, I'm working more so with providers, as how we connected to a few weeks back, right. Working with our hospital systems as well in the emergency department, and then all the way to outpatient and inpatient units too.
Yeah. And that's great, because I think that a lot of times we're faced with not knowing where to go. Exactly. You call for psych, and it's not really necessary to have a psychiatrist on board, but just somebody that they can say, hey, this is what's going on. I need resources, because sometimes it's always not medical. It's not always a pill is not going to change everything. Yeah. So Charlie Health's virtual intensive outpatient program offers structured, evidence-based therapy. From your perspective, how has virtual care changed the way people experience healing and support? And like you said, one of them is having access to it.
Yes, absolutely. And then even further past that is us being a virtual IOP. Is a main component of that is group therapy. Okay. So with the group therapy piece, though, is being virtual, we're able to really curate these groups and make them specific for individuals and to really align with who they are, what their treatment needs are. I think sometimes there is that barrier of joining a group, and you might have one person who maybe they're a college student and they're homesick and they're having some depression, anxiety around that. On the other hand, you might have a new mom, and maybe they're really struggling with postpartum depression. Traditionally, in group settings like that, people don't always feel as connected with their peers in that group. So being that virtual higher level of care, we are taking all those things into consideration to match them with groups who are going to be the most appropriate for them. Just the whole idea is just for them to be able to get into their therapy groups and say, oh, me too. I thought I was the only person who had this very specific, unique experience. And you would hear people thinking that they were going crazy because they're the only ones to experience that. Being virtual, we're able to kind of cast a wider net in that sense, where we can make those connections more seamless.
Okay, good. Yeah. Good. All right. So the IOP includes specialized tracks for LGBTQIA. There's been some more letters added to that, I think. Plus. So what is that?
Yes. That is going to be our lesbian, gay, bisexual, trans, queer. What's I? That's the one we might need to.
And A.
We might need to cut this part out.
Okay.
Because I think better look it up. I think that those have been added on.
I don't know. Indecisive? Okay. Anyway.
I know. Those are some newer ones.
Okay.
Which is not, and I'm dropping the ball there.
Okay. That's all right. So LGBTQIA and BIPOC. Yes. Is that BIPOC?
Yes, BIPOC.
Okay. And so so I know the LGBTQ part. What is the BIPOC?
Yes. That is going to be Black, Indigenous, people of color.
Okay. And then neurodivergent?
Yeah. So neurodivergence, that could be, anywhere along the neurodivergent spectrum, whether that's an ASD, an autism, maybe disorder.
Like that?
Yes, exactly. So that one's going to look different too, group by group. So that also would include ADHD, ADD diagnoses as well. Okay.
And then you have new and expectant mothers. Okay.
Yes.
So why is it so important for mental health care to be culturally responsive and community centered?
Yeah. So really with that too is having those connection. At the end of the day, it's all about connection. We want to feel heard. We want to feel validated. And just being able to really tailor these mental health therapy groups in our IOP is, we do notice that group is going to be more effective for people. They're more engaged when they're understanding what their peer is going through to a certain extent. And then you also have those individuals who are in therapy and they're able to speak on their life experience to kind of give that feedback, that conversational piece with those in that similar group. I always do like to point out, while we do have those specific tracks and cohorts, if someone's not a part of any of those communities, that is A-okay. We still have other groups that would be appropriate. That is kind of taking it a step further for those who are identifying in parts of those groups, making sure that they are matching with one if that's in their best kind of wishes and the clinical appropriateness.
Yeah, that's great, because you don't want to just group people because you think that.
Exactly. Yeah. That's always like a conversation piece too, is, someone coming in and, we have, like our DBT skills training group that we do have running over at Charlie Health, is that can be a little bit more broad as well, where it doesn't necessarily need to be someone else coming from one of those other specific communities, but really just making sure that the modality is also going to be appropriate for their symptomology, for their diagnosis. Okay.
Well, that makes sense. And I'm glad to hear that culture is being considered, because I have to look at culture a lot of times too. I have patients that come in and, and they're coming from other cultures, and there's just certain things about them that are just different. And sometimes we can take it as they're being rude or they're being abrasive, but it's really just a cultural thing. And and when you know that and you're able to kind of like put yourself in their shoes too, sometimes there's a language barrier, and sometimes people are just in a brand new, environment, and it's just overwhelming for them. So so I think it does help to have to take those type of things into consideration. So I thank you and Charlie Health for considering that, because we see it so much. I don't know. Were you familiar with Daniel Prude?
I was, yes. I think that was before I moved here, but we did talk a lot about that in my MSW program at Nazareth. So I was, brought up to speed there.
Yeah. So, and you just seeing that was very sad, because it sounds like he got shuffled around. The family didn't quite know what to do with them. There was a drug abuse issue, and there was also people who had videotape of him when before this tragedy happened, and it just seems like I don't know, the ball was just dropped. The ball was just dropped, and he needed help. He was
struggling. And that is also like a big reason why Charlie Health will never have a wait list, because they've identified that so many people that they need that help. They're struggling. And when we have systems where they have weeks on weeks wait lists, is we are letting people fall through the cracks. So we need that intervention more seamless earlier. Just so we can really step in and help that with what they are struggling with. So
did you see like a big occurrence of, and I shouldn't say big, but an occurrence where someone reached out for help and they weren't able to get the help, and then it ended up in tragedy? Did you see I shouldn't say a lot of that, but how does that resonate?
Yeah, I know, that hasn't been something I've seen in my role here with Charlie Health, but I know even just thinking about my own like friends who are, people that I grew up with, they might have been like reaching out for help, for support, but it maybe like wasn't taking it as seriously, or just like, okay, it's fine, you just had like a bad day. So I think sometimes when those attitudes are being very dismissive of what they are going through, maybe like the cultural components, as we were talking about, that's going to weigh a lot on people until it's going to build up. So I know that's a hard thing, I think, to deal with when we know that there are people out there who do need help, that timely, immediate intervention. But unfortunately, we kind of are in a mental health crisis still, excuse me, where we do have wait lists. Clinics are packed, right? So really the whole idea too with Charlie Health is just supplementing the services too, like when we can be that more intensive level of care. And sometimes we see also is someone might really prefer in person, and that's okay. We're fully virtual, but if someone's waiting a month or two to get into an in-person program, we often see people are able to do our program in the meantime to still give them that intensive healing while they are waiting, instead of just kind of going home and twiddling your thumbs waiting to get into a program. They can still have this structured healing virtually.
Yes. And I know I think a big thing with, I use the word suicide. Some people use unalive, but to me, it means the same. But when people are, I think one of the biggest things for me is that when people say, like there was a young lady in a gym I used to go to, and they were saying, oh, we just had a cookout in the backyard. Everybody was having a good time. She was there. Nobody knew anything. And then she left and went home and unalived herself. And so people were just like, and then they had, they're showing video and pictures and stuff like that. And, if she just, you don't see the pain, and then you say, what was I missing? I mean, I think then there's some remorse there too.
Sure.
Because it's like, well, that was my sister, or that was my best friend, or why didn't I notice that? How come I didn't see that,
Yeah, it makes you think there also, because those are the situations where, like, I just saw that person. They were happy and they were dancing at this get together party, and it's kind of like that shock factor too. Then, where we're going to go through those stages of grief as well, and really starting with that denial piece. Like, how could that have happened to that person? Like, there's no way. But we're seeing that surface level. They're really good at sometimes masking their emotions. A lot of times people, when they are really struggling, and to this level, is they become really good at masking their true emotions. So kind of putting on that mask for others to see someone who's really happy, really funny, like and they become really, really good at it, but we have no idea what life is looking for them when they are, they're getting in their car. That mask might be coming off. The second that they're in their car, they're home behind closed doors, is what is really going on when there's not like an audience per se.
Yeah. That's true. So you often meet people during vulnerable moments, and they're realizing they may need a higher level of care. So how do you approach those conversations with empathy while still empowering people to advocate for themselves? Yeah,
and that's such a good question too that you do bring up, and like with that empathy piece, just leading with that empathy and not always saying, before getting into like all the nitty-gritty details, just giving them like a moment to kind of breathe and like, okay, like it's okay, like we have the time for you to relax. And because also kind of what we were talking about before is when someone is maybe making that initial phone call for help, they most likely didn't start struggling that day. This most likely has been building up until they have that point where they're like, okay, it's time for me to receive help. And it can be really scary to admit that, I think, to ourselves sometimes. So I think one is just being like a listening ear, validating how they are feeling. And then we'll also having that shift where, what are those next steps that we can take to get you connected with the help that you do need? Kind of giving that space to kind of build up for where they do feel comfortable. Because at the end of the day, like, we still are initially a stranger when they are reaching out to anyone in the mental health world. But I think just kind of being kind goes a long way for people. And you do notice that people are sometimes shocked to get a real person on the phone as well. Sometimes they're used to like the robots, the AIs, and it's like, no, connect me with this person. And at that point, if you're 6 stops through a tree line, I'm hanging up sometimes too myself because it's frustrating. So I think, just being a human at the end of the day is just, it goes a long way.
It does.
Yeah. It goes a long way. Like, I think a lot longer than some of us think. But I always have to remind myself of that too.
Just being kind and polite and just kind of empathizing with people. And then you're right. You get on the phone, or they say, okay, well, nobody can answer your call right now, but leave a message. And we're like, like somebody's going to do that. You know what I mean? So,
right, exactly.
But at the same time, there's no perfect system either. So sometimes people are not going to be at work, or they're going to call in, or there's going to be shortages, and there's going to be somebody on the phone with somebody else when that phone is ringing in. So, there's no perfect answer, but I do think it's important, like you said, that we can all contribute to another person's well-being by just giving them that smile or saying hello, and then noticing sometimes when people look like they're just not, and maybe even asking, "Are you okay?"
Exactly. Oh my gosh, yeah, and even in like my own personal life, is if I see someone and maybe they're wearing like a shirt I really like, I'm like, that's a cute shirt. Is even a few years back, I probably wouldn't have said anything. But like, if I'm seeing something where I'm like, wow, I love their hairstyle, whatever it may be, I go out of my way to leave that compliment, and they're like, oh my gosh, like that just made my day. And even like when you receive those compliments in public, sometimes it really does. You could have like the worst day at work, right? You could just have, and and you're just like, oh my gosh, and it totally shifts your mindset. So there needs to be like more positivity. There's just so much heavy stuff going on right now in the world, and it's a lot. I'm victim of this, but I doom scroll on my phone, and it's just one negative thing after the other. And I'm like, wow, like I'm in such a funk right now. I'm like, I'm just, absorbing this, like it's hard stuff to read too, just given, I'm sure, everything that's coming to light right now. And then it really just comes back to like being a human at the end of the day, and being kind when you can. not only is it going to make someone else's day, but it does make ourselves feel better too, I think.
It does.
Especially in our dark, dreary days in Rochester when we don't see the sun.
Right. And even sometimes people see the sun and they don't see the sun.
Exactly.
You know, I was having a conversation with someone the other day and I was telling them, like, you know, we didn't ask to be here. You know, we just show up on this planet with these families and these circumstances and these situations. And even though, you know, some are better than others, it's like, you know, what is the point in us being mean and nasty to each other? We all ended up here the same way. Yeah. Of course, at least allegedly. Yeah. Because, I don't know, maybe we were dropped off from a spaceship somewhere, right? Because I definitely think I came from outer space. I think I'm a space baby. Because I had 7 fingers. I mean, I had 7. I had six fingers, right? And so I was looking at this documentary one time on WXXI, and they were showing like these aliens driving these flying saucers, right? So they had to put their hands into like these little dust, right? And they had 6 faces. So I said, "Oh my gosh, my ancestors! Come back and get me!" So people always say, "You had 6 fingers." Yes. And so one day I'm probably going to realize that I really am from outer space. So Brik Chickens from outer space. Yeah.
It reminds me, my aunt, and she does watch this, I'm sorry, but she has webbed toes. So she could be from a duck family.
See,
you have no idea.
You never know. You never know.
You never know.
Oh my goodness. So for listeners who may be struggling silently or unsure if they qualify for support, what message would you give them about seeking help and building resilience in their mental health journey?
Yeah, I think as cliche as this might sound, like knowing that you really are not alone and that there are people who are feeling the same way and they're going through similar things. And there also are people who do want to help and they are trained to help and intervene. I think, you know, representing Charlie Health and the outreach side, it's always a really great place to start if you are needing a more intensive level of care. And, you know, sometimes people come our way and they learn that we are more intensive, being 10 to 12 hours of therapy a week. Some people are like, actually, I really just need like a therapist that I can see once a week. Okay. That is totally okay. We can send you like, you know, who we are trusted with, like in the community, who are kind of like my go-tos for referring people out that way, where I know what insurance they take or if they have a wait list or not, or what specialties that they have for that individual. And, you know, at the end of the day, that there are so many great resources within the Rochester community as well, that they are specific to needs too. So, I think it takes a lot of courage to make that initial phone call, that initial text, that email maybe. But the ball really does start rolling once you are able to kind of get to that point. Okay.
So what about people who may not have health insurance? I mean, I get it, but I know there's like suicide hotlines and mental health hotlines, but I mean, how much does that always do? You know what I'm saying? So what options do you know of any resources or where they should start if that is the issue other than the emergency room maybe?
Yeah, I know NAMI Rochester and the Mental Health Association of Rochester, they're both located in the same suite right over in Village Gate. Okay. They have a lot of great resources, often too, like free of charge.
You said NAMI Rochester?
Yes, NAMI and Mental Health Association of Rochester. Okay. And they're actually right across from each other too. So, and I know that where they are located, public transportation, they do have bus lines that go through that area. Yes. I rely on them as community partners, national partners as well, since, you know, most cities, if not all, do have a local chapter.
Okay. Oh yeah, because we actually have a restaurant in the Village Gate.
Oh yeah, yes.
So I'm gonna go up there and check it out, and I'm gonna get some information from them the next time I'm over that way.
You should. They're wonderful, both of them, both NAMI and MHA. So,
MHA. Okay, all right. People can Google that and just give them a call.
Yeah, absolutely.
Okay. And that's a good thing. And so, as far as Charlie Health goes, I know that you do a lot of physician. You know, usually the physician refers. So what about people who may not have a physician? Can they just reach out, or how would they do that?
They, you know, if they are interested in Charlie Health Services, calling into our direct admissions line, that is 24/7. So we will leave that number for you guys to have on hand. That's going to be your fastest way to get someone to like live on the phone. You can also fill out a form on our website too. So those are my recommendation for options to reach out to see if you do qualify, if you are a good fit for this level of care.
Okay, that's great.
Yeah.
And I am taking new patients, internal medicine, adult patients.
Yes.
So you make sure you send anybody my way. I'm at Ridgeview Internal Medicine, and we're online the same way, Ridgeview Internal Med. And I'm Beth. Yeah, Beth Panetta. We are wonderful.
We love Ridgeview.
Yes. And I am taking new primary care patients, and we would be glad to have you if you just give us a call. We're at 585-342-3870. And if you need some mental health options, we will definitely get you over to Charlie Health, and Dori might even give you a call herself. So do you have any advice to give anyone? I mean, you've gone over, and I really do appreciate you coming so quickly at the last minute. Like she said, we just met a couple of weeks ago, but when I saw that Charlie Health was interested in helping different cultures and different types of people, that really resonated with me, because I think a lot of times we look to people and we see certain things in people, and we don't think that we look at them other than human, I think. And we've really got to stop that. We've got to learn to embrace each other. And I love that you all have focused in on that and said, hey, these people need help, and we need to offer that, and they need to be around people that look like them, that have those same similar characteristics or same things that they may be going through. And I think that's very important, because it's a certain comfortability, you know, with that.
And, you know, I will say too, I don't think I mentioned this, but just really being mindful of those cultural components in language is not only are all of our services offered in English, but also Spanish, where that is not translation services Spanish. Full groups will be running speaking Spanish, including like the facilitator, the admissions line that I referenced as well. I think it's like, you know, option 2, we will speak with someone on our team who is Spanish speaking in live time. And that's been huge too, and really exciting. So full services offered in both English and Spanish at this time.
Oh, great.
Hoping to see where else that can take us as we get like kind of more demand as well for other languages. I mean, we can always accommodate translation services too. But you know, we have a lot in front of us too. So we will see what the future holds with expanding like languages, and even like the groups that we did talk about of, you know, when we do see a demand from patients. Like one of our newer groups too was young adults who are identify as male going through trauma specifically. We noticed a huge increase in that rate, in that demographic there. So we were able to create a specific male trauma cohort.
Okay.
So we do really like to listen to the patients too, and we are seeing these trends in terms of like symptoms, diagnoses, is, you know, what is going to be most effective for people coming into treatment. So we're excited to see what's next and how else we can really expand our care.
Right. Well, that's good. And I'm excited about that too. And I also think that when, you know, right now with everything that's going on with immigration, and I understand that there's probably a need to control the borders, but I'm quite sure that some of our Mexican per se, brothers and sisters out here are very, very concerned. It's scary, you know, and, you know, coming somewhere and arresting people. And I understand, I mean, I see both sides of it, but that's got to be very, very stressful for anyone, you know, who may be here, maybe, you know. So are you seeing people coming in with those types of concerns? Is that a growing
absolutely, like, yes, it is. It's hard because, like, yes, we are seeing that. It's heartbreaking. You know, people are also scared to maybe go to their local clinic for services. Right. So I think also just like being virtual, people are able to remain anonymous and feel a little bit safer sometimes. Okay. Being able to engage in mental health services that way. So I definitely do think like that is a pro of virtual, is people are feeling a little more safe, more confident in their community. You know, just given the climate of everything going on, it's, you know, there's some hesitancies to go out in public right now. Right.
Yeah. So they can remain anonymous and call in to Charlie Health and get some assistance.
Yes.
Okay.
Yeah.
All right. Well, that's beautiful. Well, thank you, Dori, for coming on. I appreciate you. You guys check out Charlie Health. We have all the information up, down, sideways, somewhere. There'll be links to contact Charlie Health, and we hope that, you know, you keep good mental health. So thank you for coming, and we'll see you next time. You know already what the hottest podcast is in the world, the Brik Talks podcast. And so we're on Anything Entertainment Network. Make sure you download that and share it with all your friends. And come out and check out some of the conversations that we're having. We got some really riveting conversations. We're talking about community. We're talking about culture. We're talking about loving and helping one another to just build a great community and to build great surroundings in our community. Make sure you look for us on YouTube. We're on social media. Keep building, y'all. Keep it Brik.